March 15th, 2021. Hi, my name's Tom Yakupin. This is the Tom Yakupin Podcast, aka Yakupinions. Today I'm flying solo, so it's definitely going to be my opinion, but I want to talk with you about a subject near and dear to my heart, and that is the hospital price transparency movement in the United States. And again, shout out to a lot of leaders, movers, and shakers in that movement, including but not limited to the Free Market Medical Association, www.fmma. Friends of mine and advocates for free market healthcare, Dr. Keith Smith of the Surgery Center of Oklahoma, Jay Kempton and Associates, who they work together, one as a benefits advisor, another really as a forward-thinking voice for free market healthcare. And of course, a chief anesthesiologist at the Surgery Center of Oklahoma. Free Market Medical Association is an association of medical professionals and people who believe in the need for free market medicine and price transparency, price honesty, among other things. But there are many. Dr. Lee Gross in Florida, Dr. Marty McCary, both very active, both have testified on Capitol Hill about the need for price honesty and price transparency. And there's so many. The list goes on, but a shout out to all of them and a shout out to you. And even here in Pittsburgh, by the way, I noticed I bumped into an excellent piece online. A young lady, Megan Schiller, I believe is her name, with KDKA, investigates the new federal rule designed to end hospital sticker shock. Highly recommend you check Megan Schiller out online. You just Google that, and I'm sure you'll find it. But this goes back to a bid. In fact, CNN, going back to June 23, 2020, CNN had mentioned that a coalition of hospital groups lost their attempt to block the Trump administration from requiring hospitals to disclose the prices they privately negotiate with insurers. And that isn't entirely the crux of the matter, but that is a big part of it. And you know, at any rate, you had a lot of hospitals pushing back against this business of letting you and I, consumers, us petty consumers, many of the big hospital systems did not want to come clean. They did not want to show you, the consumer, the price of things, their negotiated prices, their benchmark prices, what you can pay cash for, what Aetna might pay for their Medicare plan, or what Aetna might pay for their underage. They didn't want you to know any of this. They didn't want you to know the cash pay price of an X-ray or an echocardiogram or a hip replacement, for that matter. And they considered it intellectual property, whatever. But a lot of us outsiders considered it, a continuation of the fraud, waste, and abuse that has been baked into our current healthcare system in the United States of America. And while I'm in no wise using this as a political platform for the former President Donald Trump, I am saying that I believed wholeheartedly in the movement prior to Trump taking it up, but certainly while Trump was advocating, along with many others, that this indeed should go down in the United States of America. And the hospitals lost the bid, and today, here we are, February 2021, and I'd like to show you exactly how that's shaking out today, especially in the tri-state area for you. Now, before we get into some things that we'll show you on the screen, which is actual pricing that two systems in our area, by the way, two very good systems. I give kudos to St. Clair Hospital, and again, I give kudos to Heritage Valley Health System, both of which I'm going to show you their price transparency tool, and why this can help you, okay, and why you should know, and perhaps even how to use it. But both of these organizations, in my opinion, doing a good job. It is important today to know what you're getting and what it is costing you. If you think about it, whether you buy a car or a suit of clothes, Whether you're buying a can of tuna fish at the store or a bag of potatoes, you price shop for it. And to be honest with you, those are pretty insignificant things. They're not going to cost you thousands of dollars. But a visit to the hospital for something like an MRI or a CAT scan or an echocardiogram or a stress test may cost you thousands of dollars, especially if you waltz in as an uninformed consumer or just follow the directions of individuals who actually aren't paying your bill and on one hand don't care about the price of things. So this business of pricing transparency and becoming an informed consumer is very important. As many of you know, as a professional at West Penn Life and Health, and then also the work I do with New Era Health Plans. As a professional, I've helped hundreds and probably even thousands of people directly or indirectly as it relates understanding health care and navigating insurance benefits. And this is a good time for me to jump in and mention that health care and health insurance are two distinctly different things. Health care is what your doctor does. Health care is what your anesthesiologist or your dentist does. Health benefits or health insurance is what I do or what insurance companies do to step up and to pay bills. But at the end of the day, today you have a lot of people, especially in the working middle class, who have a lot of flesh in the game when it comes to health care in a non-emergent situation. So let me talk with you a little bit about emergent health care and non-emergent health care. Emergent health care is when you're really not going to be in a position to shop, right? It's when the gentleman grabs his chest because he really is having a heart attack and is taken, by ambulance for care. That individual, is going to be at mercy of the system, to be very frank with you, because they're not going to shop. But I want to say this: most healthcare in America, in fact, many professionals estimate as many as 7 out of 10 or 70% of healthcare in the United States is not emergent healthcare. It's not emergency. It's more like this: somebody has a symptom. They go see their primary care physician. They discuss the symptom. The physician then says, I think we should get x-rays or imaging or do blood work or whatever to do a deep dive right on those symptoms to determine if there's something that should go to the next level. That's how most healthcare works. And this is where knowing the price of things can really help you. Why? Because for many people in the United States today, for example, if you buy your own health insurance, if you're self-employed, an individual or small business, and you make plenty of money, you're typically not going to get government help. You're not going to get a subsidy because you're doing good, okay? It's kind of a reverse form of discrimination or penalty, but you're going to pay full boat for your Obamacare plan, and it's going to be pretty expensive. It can be very expensive. So in many cases, what people in that working middle class are doing is they're enrolling in plans with very high deductibles. Why? Higher deductible, lower monthly premium. So in some cases, individuals might have $5,000 or $6,000, maybe $7,000, maybe $8,000 out of pocket before their health plan actually steps in and pays much of anything. So it's that individual who has a lot of flesh in the game that will benefit by asking these questions like, what's this going to cost me? And negotiating and looking for different vendors. That's something we've never really been challenged to do or even encouraged to do as consumers in the United States. And I want to share with you that it's one of the reasons that healthcare prices keep trending up and up and up. Why? Nobody's asking these important questions like, what is it going to cost? We're just trusting that everything is going to be worked out magically between the insurance company and the provider. And in many cases, consumers are assured you're only going to have a co-payment or, this little amount out of pocket. Therefore, they're even less motivated or incentivized to be good consumers, right? This is part of the problem. Insurance actually has created much of the problem with healthcare pricing. It is behind the veil of these negotiated prices between managed care health plans and the hospital facilities that either they own or contract with. It is behind the veil of these negotiated prices that a lot of shenanigans occur, okay? And you're going to see some of those shenanigans. And by the way, if you think about it, it's where most bad stuff happens. This is why we're happy with any organization, politically or otherwise, that speaks truth to this subject and is willing to shine the light on some of the dark places in America with healthcare. So pricing transparency really is a practice that many, including Heritage Valley, believe will benefit our patients, as they say on their webpage, and be an important part of healthcare decisions. Now, we're going to start with maybe the more complicated of the two options available for consumers, but it's a place to start, and you should be able to see this on your screen. I'm just at heritagevalley.org, and you can see a little bit. They're talking here as it relates their policy for price transparency, and then it gives you some choices down here because they have a Beaver facility, a Sewickley, and a Kennedy Hospital facility. So I'm going to go ahead, remember to use the mouse here, Tom. I'm going to go ahead and click the Beaver facility, and as you can see, it's uploading here in an XLS spreadsheet. I believe we can go ahead and pull that baby right up. And one of the things that you're going to find as interesting as me is just how many different things these providers can bill for. So on your screen, you're going to see some of what is now available to the consumer. And while I will admit to you that this is not the easiest thing to navigate, and I don't even claim to know everything about what I'm looking at this moment. But what I can tell you is that I know more about it than you do and more about it than most. And I want to stop by just showing you a couple of simple things. And this is where I have a problem with what has been going on. And this is why I have some degree of joy and optimism about what is going on. Because anytime we can bring price transparency to a marketplace, when consumers are educated, they tend to make better decisions. And I think those better decisions are going to help trend things in a better direction. Now, on the screen here, what do we see? Well, you can see basically every test, treatment, surgery known to man, right? And in the medical billing world, medical billing is guided by what is known as a CPT code. And I believe that that's what you see here are various codes that relate to, these many situations that we're going to look at. For example, in simple EKG or a treadmill stress test, or here you can see, follow-up echo with Doppler. Down a little further, you can see, Holt recording, Holter analysis. You can see just on and on and on. Pulmonary conditions. It's amazing. Okay. So over here in this column, this is what I believe is known as a benchmark price or a charge master price. What is that? So when you're talking with people at the grocery store or at the barber shop about their experience with healthcare, right, which is pretty, and I'm not knocking anybody, it's usually pretty uneducated what is being shared out there, or it might just be misinformation innocently shared between parties. But usually when people refer to the cost of things, what they're talking about is what I call the fake bill or the phony bill. For example, if you can see my mouse moving here, temporary pacemaker insertion. You can see the codes, and then you can see the benchmark bill for such a procedure at or about $9,929. And this is giving you an idea of a benchmark or charge master. Let's call it the retail price, right? This is like walking into Kohl's, before you get the 50% markdown on the men's suit or the woman's skirt. This is basically their price that they just pull right out of the rabbit's hat, $9,929. What is interesting is in this next column, you can see that if a consumer walks in and says, I don't have health insurance at all, and I just want to pay cash, what's my price for this? Well, guess what? It isn't $9,929. It magically reverts to $2,680.83 with no insurance. Okay, just like that. So on one hand, if you ask prior to this law and people drilling down on complying with the law, if you were to just call a facility and say, hey, what does a temporary pacemaker insertion cost? They may have given you $9,929 as an answer, if you could get anybody to give you any answer at all. But the numbers could be all over the place. And there is much confusion because I must assume, simply because there were three options as to which facility we want to click, Beaver, Kennedy, or whatever. There may even be differences within Heritage Valley. And I'm not necessarily criticizing them as much as I'm saying to you, the consumer, and to my listening audience, this is an important difference, 9,900 versus 2,600, especially if you're paying most of it. Okay. Now here's another interesting number. The minimum negotiated charge for the same thing, and I have yet to figure out exactly what this might be or who gets this deal, but the minimum negotiated charge for such an insertion, a temporary pacemaker insertion at Heritage Valley could be, and apparently is, as low as $214.37. Now that is quite interesting because, yet again, it's a significant decrease. We go from $9,900, the benchmark or the retail price. We go from 99 to 26 if you're paying cash with no insurance. And then there is evidence here that somebody somewhere has negotiated a rate as low as $214 for this almost $10,000 procedure. That's pretty good negotiating skills, by the way. But this is part of, friends, what is going on in our healthcare, our delivery system today. Now, what is just as interesting as everything as we've been discussing up to this point, as you can see that these numbers just continue to vary all over the place. For example, now as you get in, you can see the hospital benchmark price, as we were saying, at 99, the cash pay at 26, the minimum at 214. But then we can see the maximum negotiated price, which is also their retail price of $99.29. Now, I don't know who they get to pay that, but we're about to see. So, for example, you go over to the next column, and if you walk in as a consumer with an Aetna health plan, you can see that you're going to be billed $2,139. Okay. Of course, with no insurance at all, I could cash pay and get a deal for $2,680, and I'm not paying Aetna $500 or $600 a month or $1,000 a month. So this is kind of where we're going with this, right? It's neat that Aetna's negotiated an even better deal than I can negotiate cash pay. But the question is it that good of a deal, especially in light of the premiums that I'm paying? Or is it even a fair deal? If you notice, Aetna Medicare winds up paying $7,383. By the way, to the consumers out there, this is why when you call a doctor office or a facility today, if you're trying to schedule an appointment, Hi, my name is Tom. I'd like to schedule an appointment to come in and see your doctor, the dermatologist, for something on my skin. One of the first questions out of their mouth, usually the intake specialist, is going to be, who's your insurance with? Okay. It's really not going to be what are your symptoms or what is best for you. They want to know what kind of negotiated price tier category you're going to be in. They want to make sure that they have all of their coding and billing practices up to snuff. Why? Because as you can see, things vary so greatly between self-pay, cash pay, minimum, maximums, Aetna underage, Aetna Medicare. What is Blue Cross Commercial going to pay? What is Blue Cross Community Blue going to pay? Et cetera, et cetera, et cetera. And see, friends, this is a big part of why these hospitals did not want you, the consumer, to know. This is why they filed a suit. They said, and they were coming up with all kinds of excuses. Oh, this is too much information to give people. They won't know what to do with it. It's not going to help them at all. I think exactly the opposite. I think that it's perfect. It's probably not enough information. And in some cases, these guys are making it a little more difficult than I think it needs to be. And on this hand, I want to show you a slightly different view and to show you how simple I think it can be. I'm going to bounce. And by the way, Heritage Valley, kudos to you guys. You've made a lot of information available. I don't like XLS spreadsheets very much. They're not friendly. I think there are easier ways to get this information out. But by the way, empowering consumers, especially with a high deductible, this may be very helpful for consumers depending on the plan that they have. Okay, if their plan is on the hook to pay full price for something and you can cash pay, get it for 70% off, you may want to post your cash pay. Say, I don't have insurance. Okay, and just write them a check or make payments on it or put it on your credit card. There are a lot of ways to cope with this. And dealing or posturing as a cash pay client is not a bad idea, which is why I'm more for freedom of choice health plans than I am managed care plans, because with the managed care plans, you can run into some difficulty. But let me give a big shout out next to St. Clair Hospital. This is what's on my screen now. If you just go to stclair.org and then we're visiting the billing area in particular. And then all that I did in the billing area was I hit patient estimates right there. And that brings up this tab. Now, I want you to see something. If you go to the patient estimate area and it says, first of all, I have insurance or I do not have insurance or self-pay. A lot of people ask me right off, if I have a hospitalization plan, such as what we offer at West Penn Life and Health, the New Era Health Plans product, it's a hospital surgical plan on an indemnity chassis. What does that mean? Freedom of choice. Go to any doctor, any hospital, anywhere. There's no real negotiated rate between the hospital and the insurance company. The insurance company pays defined benefits. For example, so much for an office visit, so much for an MRI. If your MRI costs more than the allotted amount, let's just use $500 with the 2-unit plan. If you go somewhere and they charge you $700 for the MRI, you'd pay $2 because your plan's paying $5. Conversely, if you go somewhere such as, I think there's a place in Monroeville Imaging, where they are very price transparent and very price honest. They have a cash pay option. You can get testing, you can get imaging, things of that nature out there, super cheap. Maybe $300, $325 for the same thing, in which case there would be more benefits than bill, so the consumer's incentivized. So we teach people in a non-emergent scenario to ask questions. I think you should do the same, whether you have comprehensive major medical, whether you have a Christian sharing plan. Many people that I know of today, especially in the faith-based community, are using Christian sharing plans, which are not insurance at all. You're indemnified in a covenant relationship with other members, but basically you're cash pay. You are accepting responsibility for treatment at a doctor, facility, hospital, whatnot. You would want to shop in a non-emergent situation. Why? Because everybody wins if you do your part to get the best price. See, part of the reason that healthcare costs have gone up is because people stopped caring. Who cares what it costs? My insurance is paying it. But the end result of that mindset is your insurance rates do what? They go up, don't they? Because people aren't caring, therefore there is a lot of shenanigans on the billing side where, for example, I have run into situations where I've learned that a provider or a facility may charge $100,000 for a pacemaker that we know wholesale costs $10,000. That $90,000 markup is paid for by somebody through insurance premiums, okay? And this is why, friends, reining things in and wanting to know and utilizing your rights, knowing your rights, and then saying, hey, if I've got flesh in the game before I get this X-ray or this blood panel or this MRI or this CAT scan, I have the right to know, and damn it, I'm going to ask. And if you call somebody and they're unwilling to tell you, then you know what? You need to call somebody else. And that's the facts. I mean, think about it. You wouldn't eat at a restaurant where you went in with 4 or 5 buddies and sat down and the menu had no prices on it. They said, hey, just, order what you want. We'll send you a bill in a couple of weeks and we'll hope everything works out. You wouldn't do that. But that's what we're doing in healthcare. Now, back to St. Clair. Let's say you want to posture as self-pay. What does that mean? That means you're going to say at the point of service, I'm paying cash. Okay, we're going to put it on a credit card, whatever. But if you notice now, all you do is click continue, and you can now pick from various situations. Let's say, for example, surgery. Now, of course, you're going to acknowledge that this is just an estimate and things may be a little more or a little less and so on and so forth. That's the legal department, right? Telling them you better put that in there. But as you can see, there is a lot of choices and a lot of options here. And you can go to, right? You can ask your surgeon or your physician for exactly what the CPT code is or what am I looking for. For example, here, you can see an arthrotomy wrist joint with synovectomy, okay? Now, I don't know what any of that is, but your doctor does. And you can see all kind of different choices and options here. And you could literally go in and here's an excision of a ganglion. I know exactly what that is because I had a ganglion cyst years ago, and all I did was somebody told me to just pound it. I didn't go to have it excised or whatever. But let me just show you how simple this is. I can go in and I can get estimate, having clicked that, and I can see that surgical estimate cash pay using St. Clair Hospital is going to cost $968.78. How about that? You pay 100%. There you go. You have selected to be uninsured or to be a cash self-pay client. Okay. Now we can reset and start over, but I think you get this. Okay. The bottom line is that there's a lot of information. For example, let's take a mammography or a mammogram, right? There's a lot of information here. We can do a diagnostic mammogram of both breasts. Let's do one breast. Let's do both breasts. Okay, we'll go with one. And I acknowledge all the legal disclaimer. I've heard horror stories with individuals about what they might pay for a mammogram. How many of you realize that if you have one breast, a mammogram, your estimated service cost, cash pay price, $57.97 or $65.88 probably out the door? No insurance required. Okay. And this is what's so interesting about the real cost of healthcare cash pay. the real cost of it. Another very common, for example, might be a CT scan. Let's just run another one. Let's do a CT scan on abdomen with contrast. As you can see, I've got to click I agree with the legal disclosure part. But my estimated service cost, $487.73, total cash pay price, $429.20. Do you know, I know people with some health plan designs whose copay with insurance would be $300 to $500 with this for a scan like this. So they're going to pay $300 to $500 with insurance at a participating facility when, in fact, if you just said, I don't even have insurance, I'm just going to pay cash, you could get it for $429.20. And by the way, I think you can get a better deal. No slam on St. Clair Hospital, but you could go to Monroeville Imaging and get it for probably less than that. What is the point? The point is, if you understand your rights, well, let me flip this. If you don't understand your rights, you don't know them, then you have no rights at all. You, the patient, are the boss. The people in the white coats with their names on, they're selling you something. They're not the boss. You're the boss. You're the one paying the bills. You're the one that gets to determine whether you want the surgery or not. You're the one that gets to determine, do we get the MRI here or do we get it there? Not your referring physician. You choose. And more consumers need to know this. And frankly, more providers probably need to hear it, that the consumer is the boss. And the more information you arm yourself with, individuals, the better off you're going to be. Let's take a look at lab tests for a minute, right? We hear a lot about this a lot. People go in for, complete blood workups, whatever, vitamin B12, vitamin D, you name it. I'm just going to do let's take a look at a coronavirus lab test. That's got to be popular today. I think you'd agree with me, right? The old coronavirus lab test. What's the cash pay price for that? $143.91. No insurance required, right? What about a blood panel, an entire blood panel? Without insurance. I don't have any insurance, but I want to know how am I doing, right? Diagnostic, neurological. No, that's not what we want. We want labs. There we go. So let's do a blood test. Complete blood cell count with differential. Okay, let's do that and take a look at that. That sounds very expensive, doesn't it? A complete blood cell count. I mean, you got a lot of blood cells. That's going to cost $11.46. Okay, cash price, estimated service out the door, $13.02. I think you get it, friends. The bottom line is, Mark Twain has been quoted as saying that it is easier to fool people than to convince people that they've been fooled. One of the challenges with healthcare and the financial services in America today is that it's become big business. Healthcare never used to be big business. If you think about the beginning of the Presbyterian Healthcare Center or Jewish healthcare in Cincinnati, or many others throughout the United States, they were organizations that were fueled and driven by people that had a passion to serve, people that had a passion to help the sick, the infirmed, people who wanted to bring the healing arts and sciences to those in need. Unfortunately, it has morphed today into a multi-billion-dollar industry. And the answer isn't really in Washington, D.C., unfortunately, because Washington, D.C. and big government has become big business as well. In fact, it's frightening to see how close big government and big healthcare, the crony capitalism, including but not limited to, in my opinion, the Affordable Care Act, literally just assures through an insurance mechanism that this system that we're talking about remains fully funded. But what we can do, where change can occur, is from the ground up. It can begin with consumers going, now, wait a minute. You're saying that a test as complex as a complete blood cell count with differential is $11? Why do I need insurance for a lot of these foolish things? Why do I need an insurance plan that pays for an office visit? Couldn't an office visit just be priced to where it's affordable cash? And the answer is yes. One of the reasons that those prices has crept up is because we've tried to insure it. It's behind the veil in many cases of an insurance arrangement. So I hope this gets you going. I hope you visit some of the websites of hospitals and providers in your area. I hope the next time you are asked to get a test or surgery or therapy or diagnostic imaging, I hope that you remember what we said today, March 15, 2021, on the Tom Yakupin podcast, that you, the consumer, are in the driver's seat. You're the boss. You have every right to ask tough questions. What's it going to cost? What would it be with no insurance? What is it with insurance? Should I use my insurance? Should I cancel my insurance? I'd call West Penn Life and Health, talk to Tom Yakupin or one of my staff. This isn't a sales pitch, friends, but this is what I do, and I'm passionate about it because the middle class, the working middle class, has been raked over the coals long enough. It seems like that the self-employed in particular, they pay the most and they get the least when it comes to health insurance. The working middle class with most government schemes seem to be the ones that shoulder the burden of subsidies and giveaways. Well, this is one way that you can save a few bucks if you're out of pocket with a high deductible plan, or you have a Christian sharing plan, or you have a defined benefit plan such as the New Era health plans. You want to know as much as you can what things cost before you sign an acceptance to treat contract when you go see a doctor or hospital. Anyway, hope you got something out of this. Visit us online at Facebook or YouTube, Spotify, many other places. My name's Tom Yakupin. This is the Tom Yakupin Podcast. If you like what we're doing and how we're doing it, click like, subscribe, share it with others. Have a great day, and bye for now. Special thanks to West Penn Life and Health, one of our sponsors. You can find them online at westpennlife.com, specializing in affordable life, health, Medicare, and retirement solutions.